My name is Soo-Jung Park, Clinical Assistant Professor, Yonsei University College of Medicine, Seoul, Korea. I'm honored to be able to present my video abstract in the newly launched section of the DDW. I'd like to talk about the effects of scheduled second-look endoscopy on peptic ulcer bleeding. This is the interim analysis of a prospective randomized multicenter trial. Recurrent bleeding after initial hemostasis is an important factor that is directly related to the outcome in the management of peptic ulcer bleeding. Conflicting reports of randomized controlled trials have been published concerning the effectiveness of scheduled second-look endoscopy in patients with peptic ulcer bleeding. Thus, we investigated the effects of scheduled second-look endoscopy with endoscopic hemostasis on peptic ulcer bleeding. We enrolled 146 consecutive patients from 8 tertiary referral centers who had endoscopically confirmed peptic ulcer with stigmata of active bleeding, visible vessels, or adherent clots between July 2010 and March 2011. Scheduled second-look endoscopy was done within 24 to 36 hours after first endoscopy, which was done by either electrical coagulation or hemoclipping and/or epinephrine injection. All patients received 40 mg intravenous injections of proton pump inhibitor every 12 hours for the first 3 days, and then 40 mg tablet once a day for the remaining 27 days. The primary and secondary endpoints are as seen on the slide. We graded the opinions of the endoscopist on the successfulness of hemostasis in the initial endoscopy. The baseline characteristics, Ruckel score, Charson index, ulcer characteristics of the patients, and the endoscopist's opinion did not show a significant difference between the two randomized groups. 7.2% of the patients in the single endoscopy group and 11.4% of the patients in the second-look endoscopy group developed rebleeding with a p-value of 0.565 when compared between the two groups. All rebleeding occurred within 7 days of the initial endoscopy. There was also no significant difference seen in the 30-day rebleeding rate between the two groups. There was also no difference in surgery or radiologic intervention, duration of hospitalization, amount of transfusion, and mortality between the two groups. In conclusion, single endoscopy with successful endoscopic hemostasis is not inferior to scheduled second-look endoscopy in terms of reduction of rebleeding. These results will be confirmed with further analysis by increasing the number of enrolled patients. In addition, further study on the effects of scheduled second-look endoscopy in high-risk patients is warranted. Thank you for your attention.